Well, welcome back to the Forum podcast. We now move close to the end of quarter three. In fact, I think we just went through the end of quarter three into quarter four, and we continue to explore different facets of our work fighting cancer as cancer charities around the world all tackling the same challenge. To date, I've really focused on chatting with my colleagues at the American Cancer Society and hearing from different parts of the organization. So this month, I'm going to take a slightly different tack, and we're going to hear from another part of the world and gain some insights into a different culture and how things are functioning in that country. The American Cancer Society has had a relationship with the National Cancer Society of Malaysia since 2005 through the Relay for Life program majoritatively. And I'm delighted to take a short look at this partner organization and hear a bit about their successes and their challenges at the present. So with that, I'm really delighted to welcome Dr. Murali to the stage. Murali, how are you?
Hello, Matt. Well, thank you so much for having me on. It's always a pleasure.
So great to connect. And obviously we caught up recently in Geneva at the UICC Congress, so we got to touch base and hear a little bit. And I thought it would be great to share some of your story with our partners around the world. So if you wouldn't mind giving us a little bit of an introduction of you and your background and how you came to where you are now.
Lovely. So my name is Murali, and so I'm a physician by training. And I joined the National Cancer Society of Malaysia as its medical director in 2018. From 2020 onwards, I've been the managing director for the National Cancer Society of Malaysia. So the National Cancer Society of Malaysia is an old organization who started in 1966. And interestingly, Matt, though, you mentioned that we've been working with you guys with the ACS since 2005. Actually, our relationship goes back a lot longer than that. From the early 80s that we've been doing a different work with the ACS, of course, not within the relay framework, but just generally working together. And so it's an old friendship that goes back decades. And so the National Cancer Society of Malaysia was originally formed to help fund chemotherapy for patients. At that time, the government didn't quite fund chemotherapy and other cancer care in Malaysia in the late 50s as we became independent. So the Cancer Society was one of the earliest organizations started to do just that. Over the decades, we've expanded and gone into, I think, we like to call it plugging every single hole in the cancer dam. So there's leaks everywhere. So the society is sometimes caught literally plugging with a little boy in the dam in the Dutch story, where he's plugging every single leak with a little finger. So among the things that the society does is we do a lot of community engagements and education work in different communities, in different languages, at all ages, at the primary school level, the secondary school, universities, and to communities and the general public. In addition to this, we run training programs for healthcare professionals to further upskill them in capacity building around cancer. And of course, we're big policy and advocacy people as well. So most recently, pleased to share with you one of our long-time works, which is the Tobacco Control Act, which was written in no small part with contribution from the National Cancer Society, was finally passed and came into law yesterday. So it's a very momentous occasion as well. It's taken us 20 years to get that bill across the finish line and finally have a good, strong piece of legislation for tobacco control, which, as you know, is a big cause of cancer globally. So that's something we've been doing as well. Other than this education and awareness kind of work, we work across the clinical space as well, running mobile hospitals, which work in the community and screen for the screenable cancers, your cervical cancer, colorectal cancer, and of course, breast cancer, among others. And we run diagnostic centers. We run a big patient access program for medication in which we provide subsidized cancer medication to patients all across the country. We also run testing facilities to help people get diagnostic tests done as quickly as they need to get it done. In addition, we run modalities like CT scans, PET scans, and other kind of diagnostic imaging. Again, all our services are offered at subsidized or at no cost to low-income communities so that they can actually get past financial burden of a cancer diagnosis and subsequently treatment. And in the support division, we work to run homes. So we have a lot of halfway homes. Whenever there's a public hospital that treats cancer, the Cancer Society has homes next to it that provide free accommodation, transport to people, to patients and caregivers when they travel to get treatment from all across the country. We also run clinical psychology, dietetics, counseling services in which we put our salaried officers in the Ministry of Health and other public hospitals in order for them to be able to provide the supportive care to patients. And we have, I think, working together with the American Cancer Society, I'm proud to share, is our partnership with the Beacon program, in which globally we're pushing our patient navigation, where we're training. I think the latest extension of the Beacon program, we start in a city in the north of Malaysia, in which we're training about 50 community navigators to start running a community-based patient navigation system around general cancer in that region. So it's been a pleasure doing business with you guys, Jay.
Wow, and there's a lot in what you just said there. So impactful, such great work. First of all, congratulations on the tobacco legislation that went through yesterday. I mean, what perfect timing to connect with you to hear that great news. And like you said, that's such a long, slow process, but so worthwhile. So congratulations on that one. And obviously hearing from you, there's lots of threads where American Cancer Society and the National Cancer Society of Malaysia are crossing over and collaborating on things, and the Beacon Initiative is another huge one. And as you were talking, you mentioned multiple languages, and I'm aware that it's a very multicultural, diverse country, Malaysia. So you have those languages and those cultural backgrounds to deal with. You also have such a geography of different islands and regions and zones. So that made me think of the question, what are your biggest challenges as an organization, as a national cancer charity? What are the biggest challenges you face in Malaysia?
I think one of the biggest challenges in terms of educational work that we do in awareness, because clinically our work is challenging, but it's a challenge that's very clear, right? So we have a problem, we can fix it. The clinical solutions are easier. But in terms of educational awareness and kind of the cultural contextualization, that's been a real challenge. Because, and I'm sure other countries now start to grapple with this as well, the States, Australia, because you see such a diverse melting pot. We've had this since about 60 years now, slightly more than 60 years of independence. We have 3 or 4 big communities, each with its own language, its own kind of diverse cultural contextualities and understandings, and of course the need for us to be able to communicate in that particular language, as well as within their own cultural framework, to get to them and bring more understanding to them about cancer. For example, if I put out even a simple infographic, it has to come out in 4 languages, and it has to not just be a translation, but really an adaptation or a culturally kind of contextual message that be very different across. We have a large Mandarin or Chinese speaking population, a large South Indian Tamil speaking population, Malay speaking population, of course, in English. So and you have all these kind of nuances that you have to consider as you build and put out messages. Very interesting, but very complicated and hard to do as well. And sometimes what works in one community or one cultural context just falls flat in another community. So that's been one of the challenges. And of course, I think you alluded very correctly to that, Matt, in the sense that geography for us is an issue. Of course, we're nowhere as big as the United States. We're a little drop in the ocean, a little island that barely pops up on a global atlas, but it's quite a wide non-urban setting in which we have to deliver care, and that's really one of the big challenges that we have in kind of pushing out the cancer control message to everyone.
Yeah, I can only imagine. But amazing work that you guys are doing, overcoming that. And that's what makes Malaysia so beautiful, is the multiculturalism, the beautiful countryside you have. But of course, it poses those problems and challenges. So share with us a little bit about the successes. We just heard about the tobacco legislation. But what else are you hitting in terms of impact at the moment?
So I'm really excited. And this one is a story very close to all our hearts, which is of Relay. So we've run Relay for close to about 20 years now. And I think one of the big challenges, like many countries, I think bringing back a physical relay after COVID has been quite a challenge for us. What's very interesting is that when we started relay, I think years ago, long before even I came into the picture, the interesting thing about relay was it was the only show in town. If you get what I mean, and no one ran a run. Nobody had these kind of big outdoor running or physical activity sessions. Today we do close to about 40 runs a month in
Wow.
any one of the smaller cities. Like Kuala Lumpur, our capital, has close to about 10 to 12 runs a week. So naturally, so it is a saturated landscape, and people have become a little blasé to the idea of runs, right? So getting people to buy into another run, so our fear, and that's one of the things to be very careful about, is the fact that we don't want relay to just become another run, because it means a lot more than that. There's a lot of depth to relay as well. There's a lot of meaning to it, and that's why we've decided to this year refashion relay. In fact, I'm excited to tell you that our second kind of torch relay runs on this Saturday, Sunday. So again, very opportune moment for us to get onto this call. So what we did is we refashioned our relay into different pieces. So now it's just become an extension of many different relays, keeping to the spirit of relay, running from town to town. So we'll have different relays in different cities as a relay. So it'll be a relay of relays moving from city to city across Malaysia. And in each city, the relay itself is broken up into 3 different parts. So there'll be an R day. We're calling it R day or relay day. And around R day, there'll be the actual run and like a physical get together event involving thousands of people. But the night before the R day is very special because we move Luminaria, give it its own space and the pedestal that it deserves, and it'll run as a separate event on the night before an R day event. And to kind of spice up everything, we've actually done something which we're now calling a torch relay, in which we actually got a torch together, very unique art piece that was custom built by an individual whose family member sister actually was a cancer patient and passed on. And so he's built that torch. And he's a sculptor, by the way, a renowned, like kind of a famous sculptor in Malaysia. So he's kind of built that torch to commemorate the journey of cancer patients in that sense. So that torch now gets moved in a relay of individuals running across physically from city to city. And we've run it as a relay as well. So each runner runs about 1 to 2 kilometers and passes it on to the next person and then to the next person. And that's how it gets moved from city to city. And the first relay that we have, the torch relay this year, concluded very successfully. We did about 200 over kilometers, and it moved over across 2 days and had a lot of very special people. At the beginning of it, at the end of it, was very poignant in that sense. So the wife of the original founder of the Cancer Society of Malaysia, who herself is a 5-time cancer survivor, was the first person to actually move the torch. So that in Juliet, so she moved. She was the first person to kind of lift up the torch and then pass it on. She walked a couple of 100 meters, by the way, and she's 95 this year, 96. Wow. Yeah, so really amazing kind of start to this. And she passed it on to another survivor. Went to child survivors, and he went through about 6 different little towns across 2 different cities in which we're holding the relay. So from Kuala Lumpur to Malacca. And this weekend on Saturday, we do the second torch relay. So where the torch will go from KL, the capital, in which there's it's a relay city, and it goes to another relay city, Ipoh, which is northern city, about 200 kilometers away from Kuala Lumpur. We're doing the same thing. And in the first torch relay, we had about 3,000 over people who came together over that 2 days. And we're going for about 5,000 people this round as the relay moves. This round, it's going through some national highways. So it'll go through rest stops on a crowded weekend. So we hope to have engagement with a lot more people. So we're excited about it, and let's see how that turns out. So basically, this is the big new thing that we're doing, reintroducing, re-energizing the Relay for Life, and bringing it back to the people.
I love it. A relay of relays between relays. And I'm super proud because when I asked you about impact, you started talking about relay, which is, of course, what I work heavily in. So that's awesome to hear. And I love what you're doing. You're thinking about it and really working out how to repackage Relay to allow it to do what it's supposed to do, and that is to engage communities with your organization. That's its primary role. And I love to hear that you're engaging different towns, not only the town where the relay is, but the towns en route via the torch relay, and that you're getting large numbers of people there who are going to hear your message, learn more about your organization, the support services that you provide, and ultimately we hope to that they would come back and support you as well. So I applaud you on that. I'm really looking forward to seeing the results at the end of the year.
Absolutely. And the ask is that when is the ACS running team coming to join us for the next relay?
The challenge has been laid. We'll have to put that down to the colleagues and see who's keen to do a run a torch relay in Malaysia.
Absolutely.
That would be fantastic.
Absolutely.
Perfect.
So,
it's been so great to connect with you today. Thank you for joining the podcast. Some great insights there. Really cool to hear about goings on in Malaysia. And we're going to keep in contact. And like you said, it's a long relationship that we've had, and it's going to carry on getting stronger and stronger.
Absolutely. So thank you very much once again, ACS. You've been a really good and strong partner to us, and really an organization that we've looked up to. I don't know if you notice, a lot of the work that we do actually mirrors quite a lot of the work that ACS does, of course, in a much smaller scale. But you've always been the benchmark for us to kind of look up to and grow into as well.
That's so great to hear, and I think we're going to continue to try to build that out as an organization to be able to be available and open to supporting as many partners, and also not just talking from an ACS perspective, but getting our partners to share their insights as well, because there's going to be countries that are more similar to yours who can learn from you and adapt your materials and information. So it's all about everyone coming together to fight cancer. Murali, once again, thank you so much. I look forward to connecting with you again soon.
Okay, absolutely. Have a wonderful time. See you.
Take care. Bye.
Bye.